So let's start. So I want to speak about fluorescence-guided laparoscopic construction of gastric tube for gastric pull-up. Esophectomy is still associated with a high morbidity and mortality. Several studies report rates up to 30% for morbidity and for mortality up to 16%. That's why our ongoing challenge should be to improve our techniques and affect our surgical results beneficial. And this is the topic of my presentation, and I hope to give you two options for answers. At first, from many other procedures, we know that laparoscopic approach almost has a positive influence for our patient's outcome. And at second, in the knowledge that anastomotic healing is obviously related to the quality of gastric tube perfusion, it should make sense to control blood perfusion, for instance, by fluorescence imaging. If you have a look into the current literature, you will find this meta-analysis from last year, October, published by Chinese colleagues. They actually analyzed 20 studies, including 4 randomized prospective trials. And let me show some interesting forest plots that illustrate their results. For intraoperative blood loss, they found a significant advantage for minimal invasive procedure. For operation time, it was still faster in open surgery, but concerning oncological criteria like number of removed lymph nodes and completeness of resection, there was no difference between both methods. Concerning respiratory complications, there was a significant advantage for laparoscopic approach, and anastomotic leakages, there was no difference between both approaches. So, in summary, laparoscopic approach seems to be as safe as open surgery, and particularly better for blood loss and respiratory complications. So what's about fluorescence-guided surgery? Scanning databases for that is only limited successful, because the number of studies on high evidence levels are very rare.